Hi, I'm Sherry Taylor. I'm one of the directors of nursing with RNBridgeProgram.com. Today I'm here to talk to you about an intramuscular injection that's going to be going into the gluteal muscle. So we're going to talk about how to give the injection and our appropriate landmark for that specific IM injection. Now here I have a model of the patient with the gluteal muscle, and here you can see the gluteal muscle is exposed, also showing to you the sciatic nerve that runs directly in the middle of that muscle. Now when we find our landmarks for this patient, we want to make sure we're not going directly into that muscle because we're going deep and we don't want to hit that sciatic nerve. So the way that we find the appropriate landmark for this patient is we draw an imaginary line both vertically and horizontally, and then we're going in the upper outer quadrant or the upper outer aspect of this muscle, so that way we stay far away from that sciatic nerve, causing less damage to the patient. Now let's talk about some of the supplies that you're going to need when you're getting ready for this procedure. You need a pair of non-sterile gloves. We're not doing a sterile procedure, so non-sterile is absolutely fine. You also need your syringe with your medication, and then you need a 1.5 inch long needle. We do a 1.5 inch so we get deep into that muscle because it is an intramuscular injection, so we don't want to actually get into the subcutaneous tissue. We need deep into the muscle, and the 1.5 inch is the most appropriate for this site. And then you need your alcohol swab. So let's go ahead and let's put our